Is a common cause of blurred vision, affecting your everyday activities. As the cataract progresses, it clouds your eye's natural lens and blocks increasing amounts of light. Your doctor may recommend replacing your eye's natural lens with an artificial one, known as an IOL. The IOL allows light to reach the back of your eye, restoring your ability to see clearly. After treatment with an IOL,
a cataract is the clouding of the eye's natural lens, a structure which is positioned behind the cornea, iris, and pupil. Like the glass lens of a camera, our lens adjusts to focus our vision. The lens is mostly made up of water and protein. As we age, these proteins change and may begin to clump together, obscuring portions of the lens. To correct this, a doctor may recommend phacoemulsification cataract surgery. Before the procedure, the surgeon numbs the area with anesthesia. Pressure may also be applied to decrease the internal pressure within the eye. This will lower the chances of complications later in the surgery. Then a small incision is made in the cornea of the eye. Fluids are injected into this incision to support the surrounding structures. The top of the lens capsule is then removed to gain access to the cataract. The surgeon then uses ultrasonic waves to fragment and emulsify the clouded portions of the lens. They are then removed. Once the cataract is removed, an intraocular lens, or IOL, will be placed into the empty lens capsule. Small struts will hold it in place. Once properly positioned, the synthetic IOL restores the patient's vision.
Like your eye's natural lens, an IOL helps you see by focusing the light that comes through the cornea and pupil. The lens focuses light onto the retina, a light-sensitive tissue lining the back of the eye. The retina converts the light rays into signals that are sent through the optic nerve to the brain, where they are interpreted as the images we see.
After cataract surgery, your vision can become cloudy, like it was when you had a cataract. But it isn't a new cataract. Instead, the posterior capsule, which holds the lens in place, becomes cloudy and may blur your vision. This is called the after cataract. An after cataract can develop months or even years later. Unlike a cataract, an after cataract is treated with a laser. In a technique called YAG laser capsulotomy, your doctor uses a laser beam to make a tiny hole in the posterior capsule to let light pass through. This is a painless outpatient
with the actual laser room sounds of me talking and the laser.
Good. Just stay good. Stay right like that. Open up really wide. And I've got a nice opening so you can see through.
And here's another photograph, or actually a video, of a cloudy posterior capsule, and I'm trying to give you a couple of angles to see from. But you can see it's our view in is probably very similar to what the patient's view out is. The laser has these little red light aiming beams that come together and help us focus the laser exactly on the part of the capsule we're trying to treat. Actually, some of the better lasers have offsets that allow you to treat just behind the spot you want to treat, or just ahead, so that you don't damage the lens. Here you can see us making an opening into that capsule, and now it's or there was a relatively clear view afterwards. Here's another view of some clouding of the posterior capsule, and the laser beams are focused right on the posterior capsule there, and you'll see the laser fire in a second, and a small opening is created. And so instead of looking through wax paper, now the patient's looking through the opening. One of the tricks that this is probably more for the doctors in the listening audience, but something I see commonly is that the lens capsule opening is made too small. And when that happens, happens usually for one of two reasons. Either doctors doing is too big of a hurry while they're doing the procedure, or the